Hi, Mr. Rouse, is it?
Yeah, that's right. Yeah.
Hi, Mr. Rouse. My name's Dr. Barnes. I'm one of the ward doctors.
Hi.
I've come to talk to you today about how you've been getting on and possibly some new symptoms you've been having.
Yeah, I came in, I don't know how much you know. I came in 4 days ago, and I had an infection in my kidneys, and that I think has pretty much cleared up. I was feeling really sick, and I mean I didn't vomit, but I was feeling it, and yeah. So anyway, I think they cleared that. I think that's all under control, but I've now got this ringing in my ears that I can. Well, I mean, my wife came to visit me, and I could barely hear what she was saying. It's really quite loud. Well, I mean, I'm a sound engineer by trade, so it's quite important. I pick up on sounds, to be fair, but I just want to know: is this normal? Is this about to pass? Is this because of the drugs I've been given, or is this because of the kidney infection? I don't know.
Okay. I mean, what I'd like to do is talk a little bit about the kidney infection and the medicines, and then see if we can piece it all together as well with the ringing in the ears and talk about where we're going to go from here.
Okay.
If that's okay. Is there anything else that you were worried about you want to talk about today, or just sort of that?
No, I don't think so. Okay. I mean, unless, well, I'd like you to confirm to me that the kidneys are clear now, okay. Obviously. Okay. But no, my main concern really is the fact that am I shouting at you at the moment? I feel like I am a bit now.
Yeah. Okay. So you've been here a few days. You said you've been feeling a lot better. And you're right, yeah. You have got an infection in your kidneys, and we've been giving you antibiotics to treat that. Okay, so it's good that things are progressing and that you're getting better. Okay, tell me about the ring in the ears. When did you first notice it?
That's been within the last 24 hours or so.
And that's not a problem you've had before.
Oh no. No, okay. As I say, I work in, the sound is my business. So no, okay. Definitely, I can tell you not.
So ringing in the ears can be caused by lots of things. Okay. One of the things it can be caused by is one of the medicines that you have received. Okay, a drug called gentamicin. Now, gentamicin is a very, very effective antibiotic for treating kidney infections. Okay. Like all drugs, it has side effects, but it's very good for kidney infections, hence why we've treated you with it, okay? And as I say, as you know, the kidney infection is getting better.
Yeah.
Now, I've got to be honest with you, okay? Gentamicin, because it can have side effects, we tend to measure the levels of gentamicin. And if the levels in the blood are low, then we may need to give you more gentamicin.
So this could get worse then if you're going to give me more?
Well, it looks like over the weekend, your blood levels of gentamicin weren't low, but you were given an extra dose. So I'll be honest with you, you were probably given a dose that you didn't necessarily need. Okay. Meaning that you've ended up with high levels of gentamicin in the bloodstream. Now, given that can be associated with ringing in the ears, it's possible that that's why you've developed this symptom. And I'm really sorry for that, okay? That's something that shouldn't have happened.
Well, it's all right. How long will this last? I assume that my levels are going to go back down again now. Yeah.
So the gentamicin levels will drop. Okay. And we'll keep a really close eye on that.
Okay.
Now, the ringing in the ears can be something that doesn't last very long. It can be quite transient. It can be something that lasts a long time. Okay. And high levels of gentamicin can also affect your kidney function as well, and your kidney function from your blood tests does seem to have gone off very slightly, and I expect that will probably revert back to normal very quickly. But the ring in the ears is something that I think we need to keep a very close eye on, and what I'd like to do is arrange some further tests and monitor you very closely, because like I say, this is something I hope will get better, but I can't guarantee it will get better. Okay.
So this could be like this. I could be like this now, forever.
I don't know how things are going to go. Okay. Now, what we do know is that ringing in the ears can be caused by lots of things. Okay, so we need to do some tests to find out what's caused it. Okay. It can be related to gentamicin, and if it is related to gentamicin, it is something that quite often will improve. Okay? However, at this stage, I think we need to do some more investigations to find out what's caused it, because it may be unrelated to the gentamicin. Okay?
Yeah, it's a bit of a coincidence that it's come on when I've come in here.
Yeah, and I think we need to be highly suspicious that it may be related to that. Okay?
Well, what percentage? What are the chances that this is going to be forever?
I can't give you a definite answer either way. Okay? Which I appreciate. Is difficult.
Yeah, it is
particularly
difficult
with your job, as you say. What I can say is that sometimes it does get better. Okay.
What sometimes?
In some patients, this will resolve. Okay, very quickly. In some patients, it will resolve over a bit of longer of time. In some patients, it will almost completely disappear. Okay.
So when am I going to know if this is going to?
Well, what I'd like to do is do some more tests. Okay. Get you to see a hearing specialist. Okay. Do some further investigations, including monitoring your gentamicin levels, and we need to keep a very close eye on you. Now, what we then need to do is see if things may just resolve. Okay, and if they do, then, as I say, there has been an error that has occurred with the medicine, and we will launch. I'm gonna do an incident report about this, and we're gonna have to have an internal review as to why this happened to try and prevent this happening again. But the most important thing is you at the moment. Now, it looks like your kidneys are continuing to get better, and it may well be that this is something that is just going to come and go of its own accord, whether it's related to the gentamicin or not. It may be something that is going to last a bit longer, and we need to do some more tests and review you very closely to find exactly what's going to happen there.
Are you going to be able to definitively tell me whether this is going to be forever?
The only time I can definitively tell you that it's going to definitely get better is if it does get better, okay, and when it gets better, okay. I appreciate it's not the answer that you want, but
no, it's not the answer I want, is it? It's not the answer you'd want, is it?
No, absolutely not. I can see I can see why this is so difficult. What I'm asking you to do is let us try and work out exactly what's going on, so we can support you as best we can in getting you better. Okay.
What do we do about this now?
Well, I think the most important thing is you and your health. Okay, we need to make sure your kidneys get better. Okay, and they do seem to be getting better. We need to fully evaluate your ringing in your ears and your hearing.
Yeah. So what do we do now to evaluate?
So
that?
I'm going to organise some tests, and I'm going to get you to see a specialist, and we're going to keep a very close eye on you.
And how quickly is that going to happen?
Well, I would hope the specialist will see you today. Going forward, from a administrative point of view, we are going to do a review internally to see why this has happened. And I think from your point of view, if this is something you would like to make a complaint about.
Yeah, I want to make a complaint about it, but really what I want to be able to hear again.
Yeah. Well, as I say, our priority is getting you hearing again and working out exactly what's going to happen. So we can start the ball rolling with that today. And if not today, maybe tomorrow, I'll put you in touch with our patient advice service, and they can start the process of helping you make a complaint if that's an avenue you do want to pursue. What I'd like to stress, okay, is this is something that, although it may be related to a medicine that you've probably had too high a dose of in error, okay, which I can only apologise for. This is something that may be unrelated and may be something that does resolve completely. And I appreciate, you're not going to have a lot of faith in us. I understand, okay, because of this. But we are going to get to the bottom of it, and we are going to help you through this.
I'm not really interested. I just want to be able to hear.
Okay. Well, what I'd like, as I've said, what I'd like to do is start that process today of getting you seeing a specialist, keeping an eye on things, getting more investigations if we need, and getting you through this. Okay. Does that all make sense?
Yeah,
okay.
It makes sense.
Well, look, I'm really sorry this happened to you, Mr. Ralphs. Okay. I'm glad that your kidney infection is getting better, and we are going to help you through this. Okay. Is there anything else you wanted to talk about today?
No, I just want the tests.
Okay. Well, I'll get on and get that organised. Thank you for talking to me today, and I'm sorry again.